1 in 4 people in Canada have osteoarthritis. Many people experience OA in their knees and hips, which can result in pain that reduces their physical activity and stops them from doing the activities that they enjoy. For some individuals, this can result in an increased risk of developing other chronic diseases such as diabetes and cardiovascular disease. Development of symptomatic OA can take many years. Cartilage changes can start as early as in your 30s or 40s. Changes may occur in the system that controls your gluteal muscles, hamstrings, and quadriceps, leading to abnormal movement patterns. Some people experience deterioration over a few months or years, while for others, the condition may not progress. Osteoarthritis is a condition that affects people across the world. There has been extensive research that shows exercise improves the symptoms for people with OA, and a specific exercise program called Good Life with Osteoarthritis in Denmark, which is known as GLAD, has been shown to address the muscle changes that occur in OA and reduce the symptoms for individuals with early to severe disease.
There are more than 50 randomized controlled trials showing that exercise works. And we've known this since 2004, but it's still not common knowledge out there. And the type of programs that we work with in our studies, from which we see a 30% pain relief, that would be 1-hour sessions. It will be twice weekly for 6 weeks. That is 12 sessions. So with that, we can see a 30% pain relief.
Good Life with Osteoarthritis in Denmark is an evidence-based patient education and exercise program for people with hip and knee osteoarthritis. It's shown that it's really effective in helping people control the symptoms of their hip and knee OA, and that it improves their quality of life. We've been fortunate in that we've been able to license the program in Canada through the Canadian Orthopaedic Foundation, and we piloted the program to learn how to best deliver it with our patients, and we've found that we got results that were very much the same as those in Denmark. And so we've been able to move forward with rolling this program out across Canada. And part of that is because with the education and learning how to do the neuromuscular exercises, where they actually not only strengthen their muscles but learn proper positioning and control of their limbs, is really effective in helping them manage their condition. The exercise program's usually offered in a group format, which is very valuable as the patients support each other, and they get to see people who have been in the program longer and the progress they've made. And people overall from this program, as well as managing their symptoms, are reporting increased physical activity. And physical activity is hugely important in managing osteoarthritis and other chronic diseases. One of the important pieces is that we actually track how patients are doing with the program. So we follow outcomes to 1 year so that we have an understanding of what their symptom levels are like, how much their physical activity has improved, and generally how they're doing from the program overall.
I'm a big supporter of the GLAD program for the management of moderate osteoarthritis of the hip and knee. We need a program like this to look after those patients that are not candidates for joint replacement surgery, but have sufficient disability that they have problems with mobility, working, or recreational activities. The beauty of this program is that it can be done by the patient at their pace, be carried on indefinitely, and it does have a proven benefit for the patient. Knee arthroscopy was used for many years to treat these conditions and has been proven to be ineffective. This program will replace that and make it a much more economic way of managing these problems, as well as being much better for the patient. I think this program is going to have a significant role to play in the management of moderate osteoarthritis over the next several years, and I'm looking forward to seeing it widely endorsed and embraced by the orthopedic surgeons, rheumatologists, and family physicians.
Osteoarthritis is something that we often associate with older people as a chronic condition, but really it starts quite young, and often people don't even understand the symptoms that they might experience that are really early signs of osteoarthritis. Symptoms like muscle weakness, tightness, that feeling like you can't trust your joint, something unstable, that can be the early signs of osteoarthritis. If we start early with good education, good neuromuscular exercise, a program that can help you put it all together, you can reduce your symptoms and improve your function. Athletes are actually at risk for osteoarthritis. They have excessive activity, repeated injury, or repeated movement that can be difficult for their joints, combined with some early weakness and tightness from overuse and imbalance. Even athletes can have osteoarthritis at an early age. GLAD is a program that puts it all together: education, neuromuscular exercise, and that focus on function and pain reduction.
The GLAD program is being made available across Canada. Information about the program and the locations can be found on the website gladcanada.ca.